guys, this is Sky. Welcome to SD Talk Show. You can see I'm here at Dr. Mattioli clinic. So today I come here to revisit my eye vision. I want to show you around the clinic. It's very beautiful and gorgeous, clean clinic. You can see behind me, this is a reception, and go high there have many room for the vision check. Also, let's go to there to see. Oh, this is the rest area. Also, you see they have the LASIK, the machine. Also, they have and I think audience know 2 years ago I did my eye smile LASIK. So my vision is 20/20, which is very nice. And this area, so when the customer come in, they will do. Hi, Dr. Mattioli.
Hi, so good to see you again.
Yes,
Sky.
me too.
Yeah.
And I'm very happy to see you and our new machine. Can you do some introduction about this amazing?
Yeah, for sure. Thanks again. So this is the RX Sight light delivery device. What this does, this light delivery device has a special UV light that when we shine on the lens implants, on a special lens implant, it's the only one, that we can adjust the prescription. So the way to think about it is, if you have a pair of glasses, you put your glasses on and they're brand new, you've been waiting so long to get them, you finally put them on, you go, hey, they're not so great. We need to change the prescription. So they'll take them back, they'll make some new ones, you put them on. Well, it's better, but it's not perfect. So you give them back. So when we do a lens implant inside the eye, it has a prescription on it. So we put that in the eye. Now, if that prescription isn't exactly what we want before, or with other implants, we have to take them back out and put a new one in. But with this light delivery device, you can sit there and I'll tell this, I need this prescription on the lens that's already inside your eye. And so it'll modify that, it'll adjust it so that we can get the best possible prescription without having to do other surgeries.
Oh, without the surgery.
Without this, this is not surgery. This is after the surgery with the lens implant. Once we put it in the eye, it stays there. A month later, we'll come here and say, okay, we need to change it. Maybe we don't have to change it at all, but if we did, we can do that up to 4 times using this light.
Can you show our audience it's how to work?
If you want to go ahead and rest your chin and forehead there for me. And then what we have is this lens to help focus the light. So I would put some numbing drops on your eyes. Okay. And if we did that, I'm not going to touch you because we didn't, but if I did, I would just put this lens right over the eye.
Okay.
And then the light will focus through here onto the lens that's inside the eye.
Okay.
So that's how it would work.
So can we say this way? So this is like glasses put on your eye, right?
It's like glasses that we can change the prescription up to 4 times.
Wow, 4 times. So how long?
If we need to.
Like how many years?
We do it at the month after the procedure. And then the treatment is maybe 1 or 2 minutes of light. And then we see you again a few weeks later. We want to let the prescription settle, and if we like it, if the patient likes it, you're happy, then we can put the final treatment. Once we do the final treatment, it locks. But if that's not the right shape, we need it to be here, the UV lights here will change that shape, and they say, oh, that's perfect, that's where I want it. We'll come back and lock it right there. So then it never changes again.
Wow. So this is without surgery?
This part is without surgery. We first have to do the lens implant surgery, which we do right across the hallway here.
Okay. So I remember you told me 6 months ago you did a surgery.
That's exactly right, and I did this one. So not only do I do this surgery, but I'm also a patient. So just like I had LASIK 24 years ago, it was time for a lens implant now because I'm older. So most of our patients, 50, 55, older than that, will do lens implants because it's much better than a laser, either LASIK or Smile. You're very young, so Smile is perfect for you. Or LASIK, those all work for patients who don't need lens implants yet. because my LASIK worked so well, I just got older, it was time for a lens implant. So I did this one, about 6 months or more ago now. And I've had 3 adjustments.
Oh, 3 times. Okay.
Yeah. Sometimes we can do them sooner. I just preferred to wait. It doesn't, it's whatever the patient likes to do. So I still have my final light treatment to do. Probably in a month or so I'll do that.
So for this one, no any painful also?
That's it.
Like pain or hurts?
Oh no, you don't feel
feelings?
anything. No.
Okay.
There's no feeling at all. And that's a good point, Sky, because there's also no recovery. So, you had Smile, you had to go home and rest, or LASIK, or I had lens implants, patients go home. It's like, you come in, we do this, 2 minutes, and you go about your day.
Oh, wow.
Yeah.
That's excellent.
There's no eye drops.
Oh, wow. Yeah, the technology is day by day getting better.
Yes, it is. And what I really like about this is it's the first in its class. So there's no other lens in the world that can do what this lens does. And it keeps us from having to do extra surgery, because let's face it, nothing's perfect in this world. So you can get the best calculations, you can have the best surgery, you can have the best surgeon, and your eye is going to heal the way it's going to heal, right? So we can't predict that 100%. So this gives us that ability to modify the prescription to make it as good as possible without having to do more surgery.
Wow. Also, can you introduce one more time for the EVO ICL?
Yeah, so EVO ICL is also a lens implant. It's what we call additive. It means we add a lens to the eye. So when we do cataract surgery, we first have to take the cataract lens out, and right then we put the new lens in. With ICL, we don't have to do that. ICL actually goes right in front of your lens. So obviously, if you have a cataract, we're not going to do ICL. We'll just do this surgery. But if you're younger but have a really high nearsighted prescription, then maybe out of range for Smile, out of range for LASIK. ICL we can put inside the eye, so it is an implant, but it goes with your normal natural lens in the eye. So ICL is it's almost like a contact lens if you think about it. A soft contact, we can roll it up, put it through a very small incision that heals on its own. It's so tiny it doesn't even need stitches, and that's true for cataract surgery as well. The incisions we make are very small, so we don't put stitches or sutures in there. The ICL has been really remarkable. There's the newest one is called EVO ICL, and it can correct nearsightedness and astigmatism all at the same time. And we do a lot of those. We see a lot of patients who aren't candidates for other things, and so they come to us because they know we do these special types of treatments.
So Dr. Mattioli, how many cases you did for your entire past life? Yeah.
Of lens implants, including ICLs, I mean, probably, I don't know, maybe 3,000.
Wow.
Yeah.
So how about the LASIK, Smile?
LASIK and Smile and lasers, where we're on the outside of the eye, oh yeah, probably about 75,000 now.
Wow, that's excellent.
Yeah.
So if audience want to contact you, can you tell audience the address, information?
Certainly, yes, of course. So we are at 2200 Southwest Freeway, which is at the corner of Greenbrier, so in between Kirby and Greenbrier, and in the upper Kirby area. And our phone number is 713-776-3937. 776-3937.
And if the audience come here, can directly call or on the website, right? What's the website?
Yes, and so the website is MVP Eyes, M as in Mattioli, V as in Vision, P as in Professionals, and then the word Eyes, EYES.com. So MVPEyes.com. And we have people that speak fluently in other languages, including Mandarin. So please feel free to call and confident that we'll be able to take care of you.